Good.
Hey, good afternoon, good evening, wherever you are. I am Kendall Martinez, right? I go by she, her pronouns, and I am the Government Relations and Policy Associate at Treatment Action Group. And I am this evening's moderator for this amazing panel. And I will ground us. We are centralized on native land. Um, I am in Washington, D.C., so I am on the Piscataway and Anacostia native lands. And I wanted to take time to recognize that. And, I just want to thank everyone for joining um, this late in the day. I know with conferences, it can be a lot, but we have a wonderful presentation and, just dialogue. Everybody can just really tune into. And without further ado, before we get started with additional introductions, another grounding is if you have any questions, please either put them in the chat or later on when we do Q&A, do the hand raise feature and we will allow you to speak. That just makes it easier for us or for the folks who are monitoring the webinar as a whole, and will assist us in that well. So without further ado, I am going to introduce our first panelist, Tara. Tara, you want to give us a warm introduction, a little get to know
Sure,
you?
thank you. Thank you. My name is Tara Stamos-Bisig. I am the founder and CEO of the Harm Reduction Coalition of San Diego. We are a grassroots organization, nonprofit, led for the people, by the people, of the people, and primarily made up of current or former drug users and or sex workers or people with other lived experience, whether it be HIV, hepatitis C, homelessness, mental health stuff, or probably a whole mixture of all of those things. And I'm a person who I was a sex worker for 25 years. I was homeless on and off for probably 15 of those 25 years. I have ended up incarcerated and in prison a long time ago, and I also have 5 kids, and all but 4 of them have been all but 1 of them have been impacted by the child welfare system. So I started my own organization a couple years ago to address the stigma and so many other things, and it's my honor and privilege to be able to come to the table as somebody with lived experience in overdose prevention, hepatitis C, HIV, sex work, drug use, stigma, marginalization, all of it, and really just be at a space to even talk about the word stigma. And it's a huge honor. I'm extremely excited for today. Thank you. I'm going to turn my camera off because I'm driving through the desert and I had to pull over, and I don't want to have it pull from my Wi-Fi. So.
Sounds good. Thank you so much, Tara. Next up, we will have a wonderful introduction by Christian.
Hi, it's Christian Boyce. I use he, him pronouns. I'll tell you all where I'm coming from a little bit, but first I wanted to start and describe sort of where my passion in the field came from. I really say it started when I was in high school. It was the bell had rung and we were changing classes, and there was a young girl in the hallway with her back against the lockers in the fetal position, balled up crying. And there were dozens and dozens of people walking in every direction in this hallway, and no one stopped and bent down and said, "Hey, what's going on? Can I take you to the nurse? Can I take you to the counselor? What are you going through?" And I remember as a teenager just being so confounded and confused that I didn't understand socially what was happening. How could we let somebody who's clearly struggling in our very eyesight, and how could we pay it no mind? And from that point forward, I was like, okay, I have to be the one who will step in these cases and advocate for people who need help and support. So that's sort of where my passion first started. So currently, I'm also here in Washington, D.C. I work at one of the only Black-led, Black-majority HIV prevention and treatment services nonprofits. It's called Us Helping Us People Into Living. Some of you may be familiar, especially those who are here in D.C. I'm in the research field specifically, and I just want to say my favorite thing working research and not necessarily the direct services side of HIV prevention and treatment, hepatitis C prevention and treatment, is that we get to ask questions and research, right, that help push all of our agendas forward so that we can all deliver the best quality of care to people. So intuitively, we might all know that stigma related to Hep C, HIV, substance use, all these things makes life harder for people, but how? What is the impact? Is it internal? Is it external? Is it both? How do we address it? How do we combat it? And even more specifically, just giving you a taste of some of the questions we ask in research is, what experiences make us feel stigmatized? How do we measure individual perceptions of stigma? How does stigma affect whether or not we engage with healthcare? At what point does stigma become discrimination? What reduces the impact of stigma? Who are the stakeholders for these conversations? Is it people living with HIV? Is it their family members? Is it nurses and doctors, people who use drugs? How do we engage these people in these processes? So these are just some of the questions we have to ask and answer to help people live better lives. So that's where I'm coming from today. Thank you.
Thank you so much, Christian. That is, you are hitting it, really showing that courage and that empathy and the need for care. So thank you for that. Next and finally, we have Yvette. Yvette, it's your turn.
Good afternoon. I don't know, it's good afternoon here in Buffalo. My name is Yvette. I work in many hats, and I'm the founder of the Giving Back Foundation. I work in another harm reduction facility. It's the same, and like Tara said, right? I just trying to stop the stigma and all the nonsense with this, the laws and discriminations and stuff that we have going on. So I have the harm reduction foundation. That means that I am mobile and I move around. And what I do is a grassroots organization that helps the community, teach the community about sex work. Right? I'm a person with living experience with HIV, Hep C. I'm undetectable. I'm in recovery, right? So all that stuff, it don't matter. I just got for today, though, at the end of the day, even if I'm in recovery. So, we just have to keep fighting for the people that we have behind us, right? They think they don't have a voice. So, yeah, that's where I'm at. Thank you.
Thank you so much, Yvette. And this amazing panel, we are individuals who, one way, shape, or another, have been affected by the stigma, stigmas of our identities, the stigmas of our statuses, the stigmas of societal pressures, of being racially ambiguous, being a member of the LGBTQIA plus community, and thus forth. And so with this conversation, I really want to kind of do a little deep dive, and and for all the panelists, this question is, let's elaborate a little bit more on some of the examples of stigma you have experienced or even witnessed during your tenure, or even before your tenure. I think a lot of people are probably really is intrigued and, seeing that perspective. And we can start off with Christian.
Okay, absolutely. So I'll sort of ground set and level set. Some of this again is going to be intuitive to folks here. But let's say that, people living with HIV or hepatitis C may internalize stigma, right? So when we internalize feelings of what we think other people hold negative perceptions about us, these feelings of shame and fear, isolation, despair might prevent folks from getting tested for these diseases. It might prevent folks from disclosing their HIV status to sexual partners, family members seeking treatment, right? So if you're preventing, or if stigma is the barrier to sort of disclosing or to getting engaged in healthcare, well, then we are going to have a problem ending the epidemic, right? And that's what our goal is. So just this year, almost 8 in 10 patients with HIV in the US report feeling internalized HIV-related stigma, while nearly 2 out of 3 people with HIV say it's still difficult to tell other people about their status, right? So this is not something that we left in the 90s. It's 2023, and the majority of people who are living with these conditions still feel these stigmas. And if the research is saying is that feeling the stigma prevents people from staying engaged in healthcare, disclosing their status, then we have a big problem on our hands. So this conference is just one small part of sort of addressing that. I'll just say I'll get into a bit more of our specific studies later, but I just want to say one study that we just started, my nonprofit, that I'm really excited about, has to do with working with folks who are living with HIV, who have a history of incarceration, to see what are the specific challenges that they have to face, what are the specific stigmas that they have to overcome to basically have favorable healthcare outcomes, right? So you want to get specific, meet people where they're at, understand the specific barriers and challenges that people have so that we can provide care and move forward. So I'll start with that.
Awesome. Yeah, and some of those statistics are staggering, that, even now in 2023, we're seeing a percentage of individuals that still battle with with internalized stigma of status. And it's just, especially with amazing advances that researchers and scientists have made into making sure, having everything pretty much combined into one pill, to, having preventable or preventative medicine to prevent the onset of HIV. It's staggering, but also sobering. We have to realize that stigma as a whole, unless we can eradicate it, it will still in a way be around it, around. So next up, Yvette or Tara, either one of y'all.
So yeah, so just a private sample, right, with my status and my HIV, right? Right now, right, I'm in a relationship, right? And my partner knows about the situation and he's fine with it and this and that. Now his ex, long time ago, right, wanna be calling my phone talking about, you could go to jail if you don't tell somebody about your HIV. Excuse me, first and foremost, I'm on billboards and I work in an agency that do HIV treatment. So please, and this is what I say about people, they need to get educated about their status, HIV, Hep C. And because if I use drugs, that doesn't mean you have to stigmatize me more than I already am. My my self-esteem is down. And I feel worthless, because I didn't make a decision. I'm talking about the stigma right now, right? Because we think that we get up one day and want to use drugs or want to do sex work or want to, whatever we do, right? We don't make that decision, right? We've been molested, we've been beaten, we got some kind of trauma behind that people don't know how to act before they put that stigma on us and start talking about, oh, look at it, she looks all messed up, sorry, all messed up, right? But at the end of the day, are you trying to or willing to be in this neighborhood and this community trying to give them, which is me, myself, because I'm only a step away, right, from using, are they willing to come up to me and say, are you hungry? Right? How are you doing? Are you, or anything? Listen, I stop, I give money away, I give food away. As you see, my truck is full of stuff because I do the same thing, and I'm grateful, and I appreciate the panelists. I appreciate y'all doing the work too, right? And having this conference to let these people know that it's still some work that gotta be done. And we have to keep showing up no matter what. At the end of the day, we have to keep showing up. And I love Tara. That's my girl.
Yes, with the shout out, yes. And and that's so important, a lot of times, people don't even know their state their own state laws on HIV or stuff like that, or they still have that stigma of very scientific and accurate entities, which I will be touching on later on. So when I thank you so much, Yvette, for really sharing that, and also sharing a little bit of your personal experience. I mean, because at the end of the day, like, there's still a number of states that still have stigmatizing language in their statutes or in their state laws. And so when we look into furtherly, we see why individuals will go to those lengths of placing that stigma of status, mainly because of them not wanting to move forward and have updated language, of having policies that doesn't make HIV a crime, that doesn't, criminalize a person just because of their status, or just because, somebody want to be, vindictive and make that, have that person go through that trauma, because going through the penal system is trauma. It is trauma. So thank you so much. Last but not least, Tara, you are up.
Can you re-ask that question one more time so that I make sure I hit it on point?
No, you're good. The question is, just elaborate a little bit more on some examples of stigma you have experienced or witnessed, or both.
Oh, I would definitely say both. As a person who has spent a lifetime being stigmatized because of one thing or another, I have also come from a background with, I'm a cis white female, and I have come from an upper middle class family, and the stigma around where I was with my educational journey or my career stuff or my choices or the number of partners that I have or had or continue to have or whatever it might be at the time, has been something that I've continually seen. And another thing that I've seen a lot is people being stigmatized for being sex workers themselves, not trafficked women, but chosen sex workers, and the amount of stigma around that being somebody's choice, that they're not, this is my choice. And I really think that we see a lot of individuals like falling through the cracks because we don't have the ability to identify them. We aren't able to hire peers. We're paranoid about people working with us in that space. And, even as the founder and CEO of my own, well, it's the communities, but it's a nonprofit I founded, I make the policies. I do that because I was tired of other people's stuff. I even find that like when I'm hiring drug users, I have to really go to bat with my other people on my board to say, you know what, like that's okay if this person is, living with this thing, or if this person is engaging in this certain behavior, that's okay. And actually let's have a space and talk about it, because we don't need to hide. The last thing I want to do is to stigmatize people further. And by doing a lot of I do a lot of research also, and so making sure that that we push against like the university systems, or the way even research is being done, period, is really important. And as a person with lived experience, I went to work years ago as a volunteer at a syringe exchange that I used to be a participant of, and then I went to work as a peer there, and they did not want to listen to me as a peer support specialist, so I had to take a piece of tape and put it over the word peer, just so that, because a peer from the syringe service program said, well, though she must be an IV drug user. And so that stigma and has been one of the largest stigma things that I have experienced is the stigma around overdose prevention and people in the recovery community. So the stigma from people who may not believe the same things that I believe, or have the same opinion, that unintentional or intentional harm that's done is costing people their lives today. And so I've really seen, I've also seen a ton of movement in a positive direction, that, we're having this conference. There's this panels full of the most amazing people that I admire, and am really lucky to be able to call colleagues and friends. I think we've come a long way. We still have a whole long way to go, but it's a huge honor. I apologize if I'm cutting in and out, or if I drop, I'm in the desert. It's hard to navigate.
Yeah, no worries. And thank you so much for that perspective. And you really hit on another area, the stigma of, being in sex work, whether it's survival or transactional sex work, and the stigmas of that, and the way a lot of individuals portray that as just being something else. And either or, it's a mode of survival, and how that community, it's not being uplifted, because
Right.
it's such a area where individuals don't either choose not to be receptive of, or
Right.
just overly just not knowledgeable on.
Well, I will tell you, one of
Yeah.
the best ways to get myself pulled into TSA every single time is the shirt that I wear that says "Outlaw Poverty, Not Prostitution."
Yeah.
So people get really offended by that. I just wear it because
Mhm.
it's my most comfortable shirt for flying. But
Uh-huh.
that's a huge conversation starter. I've also gotten had my entire luggage tossed because of that. So
I might have to snag me a shirt after this call. But for real though, when you are, dealing with a situation where you don't even know whether or not you're going to have a roof over your head, or food to eat, but yet, you do something that, is helping you to survive. I mean, it's just, we could have a very, very long conversation on that, but we will keep it moving. And, I do have another question, and we're kind of going to a different area, but in the same realm. And the question is, how have you or others been able to overcome stigma? What type of advice would you give to others with lived experience who are dealing with stigma in their lives? we can go to whoever is down to go first on this one. A free for all.
Wouldn't mind getting us kicked off, and I'm just speaking, or I'm going to speak rather, from what we're trying to understand if it works in research, right? As far as to help folks get over and get through stigma. So another research project that we're just now starting is delivering what in psychology they call cognitive behavioral therapy, delivering this to groups of folks who are living with HIV to see if we can sort of build resiliency skills amongst these people, amongst this population of folks. So that's something, and I think that one's unique, is because the idea is to not rely on clinical psychologists to deliver this, but community healthcare workers. And so if we're able to successfully administer cognitive behavioral therapy to build resilience in the face against stigma for folks who are living with Hep C, HIV, or even folks who engage in survival sex work, any of these sort of stigmatized identities and experiences that get grouped together, well, then that's one way that we hope, we can reduce the burden and just help folks stay engaged in care and take care of themselves. Since we obviously realize that stigma is a legit, barrier. And just very briefly, for the study that's working with folks who are formerly incarcerated, we're also looking at how more holistic support might help folks. So instead of just relying on social workers to help folks sort of with the reentry process, what about gym classes and gym memberships and yoga and gardening and more types of engagement, so people feel better, well-rounded, and not just like a returning citizen and like sort of the negative stigma that comes with that, right? So we're trying to see if folks who are engaged in more holistic services and more holistic support, maybe they also have better healthcare outcomes in the end. So those are just two things. Yeah, I'll give it away to, I think, Tara, you're coming off mute.
I'm not sure if Tara heard you, but we can go to Yvette or Yvette. Sorry about that. Yeah.
Yes, what was that question? Sorry, I'm driving.
Oh, you okay? The question is, how have you or others been able to overcome stigma? What advice would you give to others with lived experience who are dealing with stigma in their lives?
Gotta keep fighting for our rights. Gotta keep showing up. You know what I'm saying? That doesn't mean because somebody's calling my phone saying, negativity, or, she's not educated the right way. She don't know. She don't want to know, right? Because she don't know her status, or she don't, of course, that's her stuff, not mine. I'm not going to stop about helping the next person who needs the help and needs the information. I have to keep showing up and have to keep carrying the message, in my story, no matter how people say or what they say about me. At the end of the day, I know what I'm doing, and God knows, and there's a purpose. We here for a purpose. And I guess the purpose is keep carrying the message.
Yes, I 100% agree with that as well. I think, really pushing forward, because this work is not easy. And it can be, I'll be honest, it can be fucking grueling. Sorry for the language, but it can. And so we have to be able to not only keep pressing on, but also learn how to, care for ourselves or whatnot, because that's what's going to lead us to that ultimate victory. Tara, I will repeat the question. How have you or others have been able to overcome stigma? What advice would you give to others with lived experience who are dealing with
Show up
stigma
every day with your boots on I'm ready to die with my boots on. And that doesn't mean that I'm kicking down doors all the time. It just means that I'm suited up every day and ready to take on whatever they're going to bring me. And I don't back down. I don't stop taking, I don't take no for an answer. When I get not invited to a table, I keep asking. I'll show up anyways. I crash those tables. I network a lot. I make friends. I learn how to bond with people. Maybe it's over their shoes or their jewelry or the perfume they're wearing or how they're wearing, the type of music they're listening to. And maybe we have very different opinions about everything else. But looking for that human aspect in everybody and meeting them where they're at, it kind of helps to break down. And I stay transparent and vulnerable. I don't wobble who I am because I'm not going to dilute myself because it's not what other people are cool with seeing. So that's what I would say. And I would say, don't, reach out to people like those of us on this panel and find out, where we're connected. And I know Yvette and I, at least Yvette and I can speak for the both of us, are happy to connect you with some of the service providers that we work with, some of the coalitions and collaborations of people, even if they're not the same type of work, they're still peer networks and they're people with lived experience. And another thing I would say is we forget, or maybe we don't, but they do, forget that we also, while working in these industry fields, also have the experience that is usually lived, and it is often re-triggering and traumatizing working in this field or being an advocate, and it takes a lot of guts. It's not just for everybody, but it is possible. And we wouldn't be here today if it wasn't for people just like us. I will also say, I'm getting old and I'm not getting any younger, and I need to make sure that I have lots of people to pass this torch down to. So I very much expect that y'all will jump on board with just showing up without any stigma or judgment against people, and taking time just to learn about them, find out who they are, what makes them tick, why does it make them tick.
Yeah, I mean, I 100%, and I'm going yes, because I mean, being able to meet people or individuals where they're at is so critical. I, as well as allowing yourself to showcase your true authenticity, while at the same time letting people know, like, hey, look, this is what's going on. And me, I've either lived this experience or I know somebody who lived through a certain experience. Being able to make that as relatable as possible, because you may never know. I remember, and we're kind of going segue over to my little portion. I remember when I was working as a legislative strategist in the state legislature in Missouri. Being able to
couple hundred. Oops.
Oh, go ahead, Tail. Oh, being able to have conversations with representatives and senators on the implications of why we needed extra funding for harm reduction programs for rural communities. I remember telling these individuals that when you have a handful of neighbors who live throughout the street being busted, for drugs, and two of them don't even know their statuses, or one of them don't even know if they can, receive help if they want help, because it's hard to get that help. Making it to where those representatives and senators realize that the magnitude of the situation is not light, it's very heavy. But at the same time, they have that power to do something that's going to benefit that individual who may be going through that struggle, or assist a community organization that's in the streets helping individuals out, with providing care, true care, not care that you just slap a band-aid and keep it pushing. I mean true constructive care, humanitarian care. And one of the areas that I'm very proud of is in 2021, during the regular session in the General Assembly, I was able to pass Senate Bill 63, which was a communicable disease piece of legislation. And with that piece of legislation, I was able to not only update the statutes on how HIV is transmitted, but also I was able to lower the criminal provisions, because the original criminal provisions was a felony. It was a Class C felony. So that's right in the middle. I was able to reduce that to a misdemeanor because of over 6 years of true advocacy, having those sit down, not easy conversations with elected officials of the reasoning why we need to update the language. And it's not just, it's not because, oh, you're trying to be, as they always say, some folks will say, oh, you're trying to be woke. No, it's the fact that we was battling language that was manufactured through severe scientific inaccurate perspectives that was severely stigmatizing. So when which would prevent individuals to want to get tested, because they were so scared that, oh, if I'm positive, hell, I'm scared to even spit, because Missouri law said that it's transmissible by spit, which you was to try, which is not the case. But individuals in the community still have that area because of the language and how that language affects over, down the line. And harm reduction, another example, harm reduction. When we talk about harm reduction, that's something in the lines, because altogether Hep C is part of that program. It's part of being able to accurately let people know, like, hey, look, here is resources for you to seek care, no matter what type of situation you may be in. Here is this critical care needed to make sure that you're good. I was able, in the same year, I was able to pass another piece of legislation in Missouri that granted community-based organizations upwards of $500,000 in outreach and additional resources for harm reduction, which was no easy feat. I walked into that realm 8 years prior And so when we was able to pass that, it was part of an omnibus bill, healthcare bill, which really changed the narrative and conversations of individuals who utilize drugs or using individuals who again are in populations that is severely underrepresented. So we're talking about incarcerated individuals. We're talking about people who utilize survival sex work or transactional sex work. We're talking about individuals who come from, specific communities that do not have the adequate resources needed to do testing, because we know that there's some deserts out there. We have areas that's very affluent, and then we have deserts. And so in retrospect, with that work, it's a constant ongoing conversation. Even now in 2023, we have Congress trying to pass amendments that will gut critically vital programs, that assist the community, that help the community know, okay, you have HIV. Here is this program that will allow you to have medicine, that will allow you to have other resources such as counseling, such as dental health care, because there's still that stigma. We are battling an uphill battle because we have various individuals who, elected individuals who refuse to see the humanity of these situations. They refuse to see the true need for these services, and why we need to not only continue funding, but increase that funding. Because it's literally saving lives. It's saving lives every single day. And if it wasn't for these programs, we would still be in, oh gosh, a horrible situation I will not go down on. But for real though, with this day and time, we have to be heavy advocates, not only for ourselves, for individuals we love, but just for everybody, because the stigma out there, it's rough. And this kind of segues to a question for Tara. So you said stigma has caused challenges and barriers to implement in San Diego HCV elimination initiative. Can you tell us a little more about and what you are and advocates doing to address the current problem?
Continuing to ask about the data, continuing to not take their answer as the golden ticket answer, because they're also the people who didn't want to do the work in the first place that we had always been doing. And when there's cracks in the system, I have a hard time with just letting those go. So even if they're internal cracks, I think we do the mission and the movement better when we address them ourselves, and then we can share that gained experience with other programs, so they don't have to struggle with that. I know one of the ways that we've done that, tried to really fight off a lot of this, was by working with the doctors at the county specifically in other areas of healthcare industry. So we looked at stuff around monkeypox. We were working around. We were looking at other different types of infectious and communicable diseases, other public health risks, and just really, I think, continuing to like, hey, let me be the reminder here. And I also will talk to the media. And I don't work for the county, and I don't have a Hep C contract. I have an overdose. I have a naloxone distribution contract. But you can hear me talk all day about distributing naloxone, and none of it's about my program because I do that out of another one too. So I really try to make sure that we get the coverage out there, so that they're held accountable. Send emails, ask the people that you know, follow up, because stuff gets lost. We have a new crisis coming out or whatever, and people are well intended, or they move jobs, and they're not the same people on that position anymore. So stay vigilant, stay classy.
Thank you
Diego.
so much for that. Thank you. I mean, and that's what it means. That's what we need, is to continue that vigilance. For Christian, you have been involved with stigma-related research. Can you tell us more about this research? What findings you discovered? Is there anything that was unexpected in some of the findings you had?
Sure. So first, just to the experience of it, being in stigma-related research, I want to say the first part of destigmatizing folks who, with all of the lived experiences we've been talking about, is just doing that outreach and recruiting them and said, hey, I work at a nonprofit. We're trying to understand some of the things that you might be going through. Would you be open to coming down into the office and talking with us, or doing a survey? We're offering incentives. We want to make sure that you feel like your time is valuable. And here at Us Helping Us, our research incentives are decent. I've worked other places where they were much less, but here, for an hour and a half long interview, we're paying folks $75, $100 for their time, because at the end of the day, these people are giving their time to open up about their lived experiences. And I've had really meaningful conversations where people say, you know what, just inviting me down here, it's like, I didn't know people cared about people like me. I've had people tell me that multiple times. And, I'm not a social worker, I'm not a doctor. I'm just trying to learn about your lived experience. And I think that really does mean something to people. And so I've some of my favorite moments in my job so far have been those moments where folks are just like, thank you for thinking about somebody like me. So I just want to say that's where that work starts. And then also on that point about what we call culturally congruent research. So as a, African-American, sexual minority man, so when I'm recruiting maybe other folks in that same population, it's a better and healthier relationship, rather than when we only have non-Black researchers sort of inviting people to come do, like there's a lot of mistrust in our various communities, women, trans folks, Black folks. We all have our reasons to sort of mistrust institutions and hospitals and things like that. So I'm also really proud to be a part of a team that looks like the community that we're recruiting. Folks living with HIV, Black women, trans folks, like just being the community that we hope to engage. So that's a little bit about that. And then also I just wanted to say that we have, quantitative and qualitative ways of measuring stigma and the impact of stigma, right? So quantitative is going to look like what we in research call a scale, which is essentially a survey where each response has a numeric value. So based on a participant score on a particular scale, then we know sort of how they. Sorry, give me 1 second, guys. And so basically, we just know, based on their scale, how we can compare that to other social determinants of healthcare. So if you wrote high on a stigma scale, what does it look like when we cross-reference that with housing stability or employment stability or healthcare engagement? So that's sort of what quantitative does, right? So we say, well, it looks like people who score this on this scale have less stable housing. So then we can sort of start to identify these intersections, and then that's where we can also sort of pass it over to the policy side, say, hey, this is what research has found. Maybe you guys can advocate for more funding. So that's quantitative. And then more qualitative is going to be much more in-depth, looking at the human experience. What has come up for you? What matters to you? What was that like? How did that feel? Those are the sort of questions that we ask in more qualitative research. So with some of the data that we've collected, I mean, we're analyzing how do experiences of racism and discrimination for Black gay men relate to the uptake of PrEP, right? So we're finding that folks who have more experiences of racism have less likely engaging with PrEP services. And what is that about? Like, you know, because maybe on surface you wouldn't see that connection. So we're going to analyze that and see sort of what can we draw out? How can we address those things? Something else that's found as far as stigma and PrEP use specifically is PrEP is still associated with sexual promiscuity, right? So that's reducing PrEP use. We're still getting new HIV cases. So we have to destigmatize sex itself before we can even get to effectively preventing new cases of HIV, right? So that's when sex positivity actually enters the research realm, where it's like we have to destigmatize so many things so that we can get people comfortable making healthy decisions. We've also found that empowerment is a better framework to getting people to stay engaged in their healthcare, whether that's for HIV treatment or prevention, rather than, oh, you're engaging in risky, you know, behaviors. And, you know, we're not trying to promote fear. We're trying to promote empowerment. Sex is okay. There's nothing wrong with having sex. Here are the best ways to do that so that you can have a happy, safe, and healthy life. You know what I'm saying? But overall, we definitely find that folks who have higher experiences of stigma are less likely to be violently suppressed, right? So the research says that this isn't an idea. You know, obviously this conference is not built over just a whimsical idea. This is something that we know is true. Stigma is negatively affecting people's lives. So we just really have to address that. I have some specifics about like different levels of social support, sort of some things that we found. But I think I want to respect time and get us through a little bit so we still have time for the Q&A.
Yeah, sounds good. And that is so important. You know, recognizing that the stigma of even just sex for the longest time, you know, even now is still, you know, seen as this taboo area, and it's not. It's human nature. And so you know, really being able to destigmatize even the most natural thing is still even an uphill battle. And that coincides with the stigma of, you know, specific populations being able to, you know, or being not only both being able to, but also access resources that will help them remain protected, utilizing services that if they need, you know, testing, having that feeling of, you know what, this is for my health, this is for my well-being. This isn't something because, oh, I did this and I feel guilty. No, this is part of me taking an accountability of my health and the health of others. And so being able to destigmatize even that is still an uphill battle. And I thank you, Christian, for highlighting that. For Yvette, your question is, as a peer-based, Tara, did you have something to add on real quick? I see you're off mute. I just want to make sure that you have something as well. If not, we can move on to Yvette. Okay. Yvette, as a peer-based outreach specialist, you are on the front lines working with people with lived experience. How have you helped them address stigma? I know that's a big question, but but yeah, I would love your perspective.
So all I could do is fight with them, right? Show up with them. And I go to Albany I talk to the legislators, I talk to the doctors, I talk to the community, I stay connected with the community, you know what I mean? And I don't have to put nobody on the first front. That's part of me. That's my story, you know what I mean? And so I have to keep coming, and like Tara says, we keep, you know, hitting up the community, you know, and letting them know, listen, our people are going through this. Why is it happening in your eyes? You know what I mean? And one of the stigma is, you know, people who are homeless right now, right? Because if they're not, so I see a lot of homeless. I see a lot of wound care. I see a lot of stuff going on in our community. And people be like, oh, it's just, they like to live out there. No, they don't. I didn't want to live out there. It's just the way we live, you know what I mean? I kept going back to it because that's what I was used to doing, right? Until the place who helped me to put me in a place, right, which it was Evergreen Health, they helped me with housing. And that's when I started getting my mental health together, my substance abuse together. And I became who I am today to work in the field, right? It ain't that we make decisions, right? We people, we not perfect, we humans. You know what I mean? But that doesn't mean we have to be punishing our people because of whatever this situation or whatever they make decisions, they do. You know what I'm saying? So whatever is happening in our community, sorry, I'm about to go into another event with overdoses and, you know, the health department in Buffalo, because I have to keep showing up. You know what I mean? Let them know, okay, y'all talking about overdoses. You know, this opiate settlement funding, what are we doing? Are we getting more OPCs? Are we, you know, I have to keep showing up. And no matter what, they might turn me down here, but I open the other door and come on the other side, you know, and that's what I do.
Thank you so much, Yvette. And that's so real. There was a model for a motto from this organization back in Missouri that said, again, forgive my language, show up and give a shit. That is the language, you know, that is something that it you know, ties into everything, because, you know, when you don't show up, but yet you get angry that there's no results, you can only be mad at yourself. Because when you do actually show up, you are possibly changing somebody's perspective. You are possibly helping them and being educated on areas where they are not knowledgeable of, or, you know, or maybe still have those stigmas due to just historical pretenses. Being able to get to an area where, you know, you are able to increase that momentum, I think is so important. And I really thank you for, you know, highlighting that, because far too often, you know, we live in a society that is now instantaneous. I mean, we panic if we don't get a text message immediately. So when we come down to it, like results and everything, it takes time. But when when things happen and we got what we want, that should be a motivator into doing more in terms of this line of work. So I am going to open it up for Any questions for to the panelists? If y'all have any questions, because I would love, even though we're limited on time, I would also love to see additional any questions from you, the audience, because this is a conversation of what we can do to be proactive of destigmatizing HIV and hepatitis C, and what we can do to build up on what we have now. So if you have a question, go to the chat, go or I don't know if we have the raise hands, if there's the raise hand option, but do the raise hand and we will get to it. I do have a question for all of the panelists, and my question is,
Kendall,
yeah,
I have to jump off this call because I have to go in this other place.
okay. Thank you so much.
You could put my number in the chat, 716-364-8569. If anybody want to contact me, they can. I just have to go in here and talk to these people though.
Okay, well, thank you so much, Yvette. And
okay, no problem. Thank you for having me. Bye, Tara.
Bye, everybody. Or bye, Yvette.
So my question for both you, Christian, and Tara is what is one of the and y'all might have hit on this part, but what are some of the huge benefits that you have gained from being in this space with your work, or even just you being just present? What is some areas that really truly you thought it was the biggest win or dub, as I call it?
I'm not sure if this is exactly where you're going with this, but I can just say one of the biggest personal benefits from being in this field and being in this work is, if I'm showing up at my job and all day I'm talking about destigmatizing, empowering people to live their truths out loud, and understanding how that is a life or death battle, right? Just being comfortable in your own skin. I mean, I've been healed in this work. I can no longer judge myself. I can no longer judge members of my own community because I know that there's a battle of life and death. And so it's a blessing, honestly, because I take that into my family, into my relationships, into my friendships, that we have to accept ourselves as we are. We have to love ourselves as we are, regardless of what we've been through, regardless of how we think, regardless of where we come from, because we have to fight all of those other battles already. So the last thing we should do is sort of spread our own stigma. You know what I'm saying? To have to fight against that. So I think I just have to spread that word from the rooftops. So that's definitely the biggest personal benefit of being in this line of work.
I love that, Christian. I want to say probably a similar thing. Like, I didn't come into this work to do a bunch of work on myself. But and it's never my intention to go out and I'm going to do this great work on myself today. But if I'm really doing the work out there, I'm doing the work on me too. And the relationships I have are richer. And I have this motto that says, the life I live is a gift from the universe. And the life the life I have is a gift from the universe. The life I live is my gift back. And so for me, it's not even about like making any kind of amends or any of that. It's truly, I get to sit in the most amazing human experiences with people that therapists don't. Like, I prefer to go, I'm going eating turkey dinner out of a tent again this year off of an EBT card as a piece of silverware, because that's where the real and true and raw, like human experience, where our souls are bared. And for me, that's just the most priceless gift that a person can have. I'd also say I've learned a lot about burnout and self-care and how to identify it and how to build in structures and systems and you know, just watch out for the things that might be triggering me or what my spots might, what my, you know, the spaces might look like for me. So that's been a huge thing because I've been able to practice that in other areas of my life as well. And I finally feel like I'm living the life I was always meant to live, but I just wasn't. And I still struggle with imposter syndrome all the time. But you know what? F them. You know what? I really seriously, I wear my cowboy boots and a shirt that says like things like F safe, shoot clean. And I'll wear that into a big meeting with a lot of people and I'll ask them, do you want me to dress up? No, Tara, please come as you are. And I've really gotten to learn how to be okay with me. And that gives me the ability to teach that to other people. They see me being cool with it, they learn it too. And it's just the most rewarding work a person could possibly, you know, but it's the most taxing work as well. So
that part. But thank you so much for that, you know, for that, both you and Christian. You know, I admit one of my biggest prides, you know, was being able to talk to individuals who was in this fight longer than I was. And when we was able to pass those pieces of legislation almost 3 years ago, and it still gives me chill bumps because it just reminded me that even, you know, even though this work is grueling, it is also rewarding too when you are able to help not only the community at large, but when you personally help somebody. I think and helping yourself in that term of knowledge and that term of, you know, as Christian said, destigmatizing yourself. I think it's really important, you know, it's one of the many benefits in this space. I also know that it can be a little bit underpaid in terms of areas, but at the same time, when you know you have an individual that comes up to you and be like, thank you for actually seeing me. That right there is the best gift of all.
that's
I mean,
riches you can't measure.
yes, yes, it is the best gift of all because you can go home and lay your head on the pillow and you on your pillow and say, you know what, I changed this person's life. How many other lives can I change because of how I brought myself to the table? And how
I like to remind the people who are naysayers or whoever, you know, but they love us. Maybe they might love you or me or Christian like anybody else. It's almost like they porn, you know, they really, they are in awe, you know. I like to remind them that all those people they're forgetting about, they're me. And all it takes is a little bit of love, a little bit of kindness, and a little bit of love goes a long, long way. And you can't teach that stuff. But you know what? I think we can. We have kids. If we just, I tell people all the time, you know, instead of walking by folks, stop and ask them their name and give them your phone number. They're not going to call you. And if they do, cool. But you stopped for a moment, come back and check on them, bring them a coffee, ask them what they used to do. You know, what do they like to do? Just take a moment to see if each of us took a few extra minutes in our day to see people for who they are, just the same way we would like to be seen for who we are. I think that's one of the things I've learned. Unfortunately, you can't really teach people, and that's one of my places of burnout. Is like, how can I not just teach you to do the right thing? And that, like, this is so easy. Why? And that's like learning when the battle is, and which hill I'm going to die on is also important, because I'll burn myself out if I take on everything.
Yes, self-preservation is key, as I always say to myself and to others. But also, showing that empathy, showing that form of humanity, because you may think, and this is a construct that we just naturally have, but having that when we have that construct of, oh, this person's okay, or this person's doing their own thing, and we don't, we sometimes don't even recognize the magnitude that that person's going, the situation that that person's going through, it's impactful. And so, I, me coming from rural Missouri, I remember, like, if I did not, do a generous smile, like a true, genuine smile to 5 strangers, I felt incomplete, because it made me, in a way, even a smile can really change the trajectory of that person's life. It could even it could literally save a life. And so I think that's another area of even stigma. We're living in this very individualistic space, and we don't have that sense of community, and that's what we should advocate on, is not only having that sense of community, but also allowing people to be like, hey, look, you know what, it is okay to say hi every now and then. It is okay to be warm and not be cold, because that's what helps us continue, and whatnot. So we have about 15 minutes left, and I want to open this portion up for any audience members who have questions. I really want to, continue this wonderful dialogue. Again, thank you so much to you, Tara and Christian, for sharing your experiences, sharing your knowledge on this. And I look forward to learning more about this, not only for the remainder of time, but in the future and whatnot. So I am going to open it up for any questions, if you have them. If not, I'll give a few more moments for questions. And I will say, additionally, this is the second day of this conference, and I have learned a lot. I admittedly will say that there was even some internal stigmas that I didn't even realize I had until this conference. And it takes power to acknowledge that. I have been in the public health space for almost 10 years. I started out of course, in the state capital in Missouri. And, I remember when they talked about HIV, it was minuscule in school. And I've been out of high school for an X amount of time. And it made me realize how, it took a hot minute for me to recognize the amazing strides that, our researchers, our scientists, our doctors have made in this space, as well as hepatitis. I mean, I knew that there was various variants of it, but I did not know. I was, in a sense, ignorant of, hepatitis, and some of the severe, some of the problems that that we are dealing with even now, even though and mind you, HCV is curable. It is treatable and curable disease, and it still affects as a percent of individuals and kills a percentage of individuals. That's what is astronomical with me, on my perspective. So this conference, I have learned over the last 10 years, but this conference have really helped me reconcile even some of the some of the areas that I was not aware of, and really make me grow, help me grow as an advocate, as a person in policy, to not only to really better myself when it comes to meetings with, key individuals. I think we gotta, okay. We got, okay, Q&A. Okay, so this question, that we do have a quick question, and it's for Christian. What protocols and procedures have been in place for research studies that you've worked on for addressing intersectional stigma experiences in real time that are shared by study participants? Oh, that's a great question.
That is a great question. I think both for, quantitative surveys as well as qualitative interviews, in that consent process, we say, look, this may bring up things that are emotionally charged for you. This may bring up feelings, just of some of the negative experiences that you've gone through. So we do prime people sort of upfront for when that goes through. But just as part of the research process, we do have to then prepare resources. So if someone is triggered, if someone is sort of brought to a really negative space, we have to be able to connect them with case management, psychosocial services, and things like that. So going into the research process, we have to already have those materials and resources provided, because again, we are asking people to really be vulnerable and really share about, trauma, right? And negative things that they have gone through. So for every study in which we're asking people those personal questions, we, beforehand, we've built materials and resources for available therapists. And I think one of the perks of doing this at Us Helping Us, which is a nonprofit in which we have in-house case managers, is just that we don't have to refer out for everything either, right? If someone is recruited for a research study, and through that, it becomes apparent that they could really benefit from like housing support or a case management, basically we can refer them down the hallway, right? So we can do that warm transfer, so they can get engaged in other services. But it's definitely a critical piece that we have to think of in research. It would be a mistake to sort of just approach this, ask people to come in for these studies, ask them all of these questions, and then not sort of equip them to, handle what might come up for them. So that's a great question.
I want to piggyback off of that. And one of the other things we do in research, and a couple of them are, we make sure that we have members of that very community that we're doing research in, that we have them on the community scientific advisory board, that we're vetting the questions with them, that we don't just, go out and say, okay, here's the questions and go out and do them. We take some practice rounds of questions, because we may even in that community scientific advisory board, like have picked that apart and said, yep, this works. And then out on the street, we find out from the first 4 people we talk to, oh my God, that's horrible. And so making sure that we pay attention to that and different participants' cognitive needs and different stuff. Also having a WhatsApp or Slack or something between staff and participants. I mean, not participants, but between staff, being able to say like, hey, I've got, and but keeping in mind all the HIPAA stuff, but hey, I've got somebody here from our study, you know, like their little set, just whatever's going on, but it's real time. And it's a space to kind of share that where it's outside of email, it's outside of all those things. And just making sure that those participant that the participants have that research that we've done brought back to them and disseminated.
Thank you so much for those. I mean, I'm very intrigued because even though I sometimes struggle with qualitative and now data, I see it as so critical for policy making. I think that that's something that we have to take advantage of, because when there's accurate data, that's going to help with the segue of finding solutions, as well as maintaining that. So
I think that qualitative data has been really a key factor in discovering new trends and discovering things that we wouldn't have asked if we were just busy asking the quantitative questions, whatever it might be, how many partners you've had. Well, we might not be asking why they've had so many partners or what they're, whatever it might be. And so just asking people a little bit more, just getting curious, doing a lot of motivational interviewing and just open-ended questions and documenting that, looking for the themes. It's hard to disseminate, but we do have a lot of qualitative data, and we've developed tools to be able to like suss out the themes and things that we had never noticed before. Some of them were around HIV and hepatitis C numbers matching up with COVID infection rates, and while they didn't have anything to do with each other, the similarity in numbers was like, oh, hey, maybe we do have something we need to look at. Let's ask some more questions. And I think it's in that space that we get to discover more about the person and not just study why they, like not just put our thing in it and wrap it up in a big study bow.
After X amount of years, I should know when I'm on mute. But thank you so much for the additional insight. I think that's so, that really help with the ongoing messaging on that. So we are getting ready to come to an end of our session, and I just want to open it up for last remarks, and then I will close us out.
I don't have any closing remarks. Just wanted to thank everyone for listening, Kendall for facilitating, Tara for being here, and I think all of us for just being invested in the work. And I think just, how Tara and I said, how we have to live this out in all areas of our lives. It's not okay to do it at work and then to not carry it into our personal life. And so I hope that we all just carry that going forward.
And Tara, do you have any last remarks before I close us out?
I just want to thank each and every person for taking the time today to show up, not just for yourself, but for your community, and for getting curious a little bit more. That's what it takes. And remember that we don't all know everything, and it's okay to ask questions. There's no wrong answers. There's no wrong questions. And it's in that space where we show ourselves as who we truly are, that we pave the way for people. We're brave enough so that others can be. And don't forget that we can do hard things. Thank you so much for coming today. It's been an honor, a duty, and my privilege.
Wonderful. And I just want to take time to thank Utah, Christian, again, Yvette, who was amazing, just for, sharing y'all's knowledge and y'all's experience, on this topic. I think that it was so beneficial. I am personally, humbled that I got to share the stage with y'all, as well as learn more about, the amazing efforts that you are doing in your respective communities. And I want to take time to thank you, the audience, for, just being here, being so interactive with this conversation. Again, we have a long way to, we still have an uphill battle with stigma, but ultimately we will destigmatize we will destigmatize areas where there have been historical stigmas, and we will achieve that goal of eradicating HCV, HIV, and other diseases, because when there's a will, there's a way, as well as make people aware that it is okay, and you should not be in a space where you feel otherwise. You should, in a way, you should feel empowered, because your life experience is something great right there, even if it's quote unquote looked down upon. That experience makes up your story, and that story could affect change. So again, I want to thank the panelists once again, and thank you. And we're good to go. Y'all have a wonderful evening and rest of your conference. Thank you.